Moderna says today that it will move ahead with the booster dose for Americans this winter, even though new data suggests its vaccine still offers strong protection. Here to answer our questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Great to see you, Dr. T. Lots of stuff to get to today, and lots of headlines from Moderna. So let's go through them one by one. Number one, the company releasing new data showing the vaccine remains 93% effective after 4 to 6 months. That sounds great, but what exactly does it mean? Is it preventing infection or severe illness, or both?
You know, obviously this is a great news, and it's an important number. It's very effective, but they didn't release the specific data, so we don't know if it's more severe infections or overall infections, just symptomatic. We'll have to hear more about the details, but it's good news to hear that you have, a 93% at 6 months. It is a powerful number.
Doctor, good to see you. We appreciate your time, as always. The company gathered these efficacy results before the surge of the Delta variant. So it begs the question, does the vaccine, is it less effective now? What's the real world data showing you based on this new emergence of the Delta variant?
So that's an important observation, Maria, that you just made. And the bottom line is, while we don't know the specific effectiveness of Moderna, we know that it's likely going to be reduced in the face of the Delta variant. Why do we know that? Because all the other vaccines have been. Pfizer has already reported a decrease in overall effectiveness with the Delta variant. And the mRNA vaccines are very similar between Pfizer and Moderna. But, and here's the big but, all of the vaccines, and you've heard me say this many times, protect against severe illness, hospitalizations, intensive care unit stays, and deaths. So that's the most important thing to remember. These vaccines are still kicking butt in that regard.
Yeah, and the Provincetown example is a perfect example of that. The number of people who did get sick versus who ended up being in the hospital and dying from it. 0 deaths, by the way. So Moderna's CEO confirmed that the company is working on a booster shot, and people will likely need one to stay safe this winter. Pfizer said something similar a few weeks ago. So do you think that's likely, that another dose is online for the mRNA, particularly in the mRNA people?
So, it's important. These vaccines have been incredible. The pharmaceutical companies that have developed them, this is just, heroic work. But the pharmaceutical companies don't decide whether or not we are going to have a booster. That is decided with collaboration between the FDA, our CDC, and NIH advisors, of course. And so what's important is we know that Israel right now is giving boosters to its most vulnerable, immunocompromised, in age 60 and older. We know that already the CDC has said it's reasonable to approach your provider if you are immunocompromised and are interested in a booster, to raise that conversation. But right now, remember, because the vaccines are preventing us from getting hospitalized, at this moment, it's not recommended that the general population be boosted in the U.S.
We've actually heard stories about people saying, you know what, I'm not going to ask my doctor. I'm going to do this no matter what. I'm getting this extra dose before it's authorized because they want to feel safer. So in your opinion, is more vaccine really better, or do we not even know the answer to that? What do you want people to know?
It's complicated, right? Because many of us have had the 2-dose vaccines, right? Some of us have had the single-dose J&J vaccines. So there's already some places in the country that are recommending that an additional booster be given, if you've only had the single booster. Remember, J&J is currently studying their 2-dose regimen, and hopefully we're going to hear those results soon. What I would say is this. Right now, if you are generally healthy, that there is really no reason that we should be boosted at this time. As far as immunocompromised patients and the elderly, like what Israel's doing, the FDA is currently looking at that data, looking at our own real-world data in the United States, and they'll be giving an opinion about that sooner than later.
Dr. T, thanks for your time.
Be well, doctor.
Take care, guys.
Have a great week.